Good evening. So I decided to do this straight after our class today. Sorry about the angle. I have my headphones trying to record my audio. So the scenario for the lab this Wednesday, which is the 29th, I believe, is blunt chest trauma with a university player who was struck in the left side of the chest with a 90-mile-per-hour fastball. He is sitting in a tripodal position, hunched over in the dugout in moderate to severe respiratory distress. Of course, he's responsive and with an unaltered mental status. However, he does complain of left-sided chest pain and shortness of breath, despite having a patent open airway with 24 breaths per minute. Both are shallowed and diminished lung sounds on the left side. And he is diaphragmatic, pink and warm. I'm not sure if I saw anywhere in here about his capillary refill, so I'm not quite sure what to say on that. His sample history seemed fine. Just an acute onset of left-sided chest pain. His vitals, I noticed a few weird trends with those. His blood pressure is very low, but he's tachycardic. He's tachypnea. He has very fast respirations, even if they are really shallow. But his O2 saturation is fine. And he has Pearl, which is responsive dilator of pupils. But it is worth noting the bruising and tenderness over his left ribs and his diminished breath sounds. In that case, I would really note he could have a pulmonary contusion or a flailed chest, because I didn't see and know about any paradoxical movement within the chest, but that's another thing, as is a rib or a sternal fracture. And not so much sternal, but definitely because of the ribs where he's complaining about that tenderness. He could have a pneumothorax, since his ribs are likely broken, which could puncture his left lung. So I would put him on high concentrated oxygen, watch his respirations, definitely keep track of those vitals like every 5 minutes, if not less, since his conditions could change any moment due to any cardiovascular issues, since the respiratory system and cardiac system run like hand in hand. I would say probably transport him as soon as you can. I don't think this would require ALS, just your basic mass transport with stabilization of the chest area, since there could be like a broken or fractured rib or something, and that could easily go all south and turn to like a human pneumothorax.